Okay, let us know when you're ready.
Yeah. Okay.
Okay, let's regroup in here.
I will be presenting the approach of the federal government over compulsory vaccination. It is important to start by explaining the situation that we are currently facing. Since December 2019, the world has changed radically due to the coronavirus disease. The pandemic has led to a dramatic loss of human life worldwide, while also presenting challenges in different areas of society like public health, food systems, and the economy. It has brought a disruption as millions of people are now at risk of falling into extreme poverty. The pandemic in the US has the numbers of, by the end of the 2020, 20 million infected from COVID, and by April 2020, there has been 31.4 million cases and 563,000 deaths. The United States has had a poor management of the pandemic, as the numbers reflect. As a consequence, there has been several side effects. There has been economic impact affecting every industry. The GDP has contracted 3.5%. This is the first contraction since 2009 and the highest since 1946. Citizens have reported loss of employment income, food insecurity, delayed Medicare, and housing insecurity. When it comes to vaccinations, up to April 13, 2021, only 22.9% of the population is fully vaccinated. In order to achieve herd immunity, there is a requirement of approximately 90% or higher. Due to the severity of the pandemic and the poor management, the coronavirus vaccination should fall into the powers of the federal government. Under the federalist system, state governments have the authority to regulate public health. States have enacted compulsory vaccinations under several circumstances. However, it is arguable that none of the precedents that will be presented have the impact that COVID-19 has had, as the spread of the virus is much more efficient. Still, some aspects of the previous health crisis can help the court determine how to deal with the new virus, creating a new landmark for politics and public health. In the first case that will be presented as precedent is Jacobson versus Massachusetts. In this case, state law gave municipal boards of health the authority to require the vaccination, determining that vaccination programs had real and substantial relation in the protection of public health and safety. Jacobson argued that this is oppressive and unreasonable. The court stated that a community has the right to protect itself against an epidemic of disease which threatens the safety of its members. Thanks to the success of the vaccination, the last outbreak of smallpox in the United States occurred in 1949. From this case, the important takeaway is that not single individual right under the Constitution is absolute. Therefore, his right as an individual ended considering the effects that carrying the disease would have on others. The next precedent is the National Federal of Independent Business versus Civilis, Massachusetts, which challenged the constitutionality of the Affordable Care Act under Obamacare. The ACA sought to address the fact that millions of Americans had no health insurance, yet they actively participated in the market of healthcare. This act stipulated that by 2014, non-exempt individuals who failed to purchase and maintain a minimum level of health insurance must pay a tax penalty. The federal government has argued that its power to act over public health falls under the Commerce Clause. Under the Commerce Clause, Congress can certainly regulate interstate commerce to the extent of forbidding and punishing the use of commerce as an agency to promote immorality, dishonesty, or the spread of an evil or harm to other people of other states from the state of origin. The power has been exercised to inform majority conceptions of morality, to ban racial discrimination in public accommodations, and to protect the public against evil both natural and conceived by people. The current pandemic falls into the terms of the Commerce Clause as it regulates interstate commerce to the extent of promoting the spread of a virus that can harm people of other states from the state of origin. In this case, the virus was brought to the country by a Washington state resident, becoming the first person in the United States with a confirmed case in 2019 of coronavirus. Lastly, Prince versus Massachusetts is considered due to the First Amendment free exercise clause that does not include liberty to expose community or the child to communicable disease or later ill health or death. The government has brought authority to regulate actions and treatment of children as the parental authority is not absolute. From this case, the most important takeaway is that individuals should not expose the community, as their individual liberties finishes when their collective liberties start. When it comes to the pandemic, we should consider Prince versus Massachusetts when contrasting our individual versus the collective liberties we have. When it comes to the history of vaccination programs are one of the most successful and cost-effective public health interventions ever developed. As mentioned before, if the percentage of herd vaccination is not achieved, the virus can arise at any time. An example for the need of compulsory vaccination is measles, a very contagious disease that is spread similarly as COVID-19. Even when a high percentage of 90+% of the citizens are vaccinated for measles, mumps, and rubella, there has been several outbreaks. For example, in 2019, there was an outbreak that led to the discussion of the benefits of mandating compulsory vaccination. In this year, there were 1,282 individuals that were confirmed in 31 states. These cases were among people that were not vaccinated against measles. Vaccination should not be a suggestion left out for citizens and state officials to decide. Instead, communicable diseases that affect a collective should be guarded by the federal government. Even when the federal government should deal with compulsory vaccinations, some laws and precedents give the state the power to mandate over this. Under the United States Constitution 10th Amendment, state government have the primary authority to control the spread of dangerous diseases with their jurisdiction. This amendment gives the state all powers and is specifically given to the federal government, allow them the authority to take public health emergency actions. The precedent cases previously mentioned have all given the state the power to decide over public health. However, it is arguable that none of these precedents are similar enough to the current situation that we're facing. Therefore, they should not be used as precedent. The decision made by the Supreme Court many years ago are for sure outdated, not facing the current issue with the severity of a global pandemic with major negative issues. Additionally, we should point out that there has been a poor and unacceptable handling of the pandemic by several, if not most, of the states. Florida and Michigan are clear examples that the state government should not be in charge of compulsory vaccination, taking in consideration the negligence towards the situation with the pandemic. Ron DeSantis has received several criticisms for his response to coronavirus in Florida. His shelter-in-place order contains some important exemptions that seem unconcerned about the situation. On the other hand, Michigan continues to add cases at a high rate, and it's currently the epicenter of the pandemic in the United States. Health experts are linking the surge to the spread of the variants of the virus and the relaxed social distancing restrictions. Meanwhile, Governor Gretchen Whitmer has resisted on more rigorous restrictions. It is rational to say that it is unfair for the citizens to risk their lives and the community by leaving the power to politicians that differ from each other, mishandling the situation. The treatment that states of Florida and Michigan gave to the pandemic is a clear example that this will end up affecting the way in which they will proceed to lead vaccination campaigns. The federal government is in a much better position than the state government to safeguard public health, considering their superior financial and scientific expertise. In addition, more resources in hand at a national and global scale. There is no right precedent because the last pandemic was more than 10 years ago. The virus did not spread as quickly as COVID, and the mortality rate was not even comparable. In the age of cheap air travel and high mobility rates, an outbreak that begins in one continent can easily reach others, and subsequently even between states. This is due to the massive increase of globalization and connectivity. Due to these alarming threats that we are facing in the near future, it's imperative that the pandemic creates a precedent in the Supreme Court that mandates the ability of the federal government to take control over similar circumstances, given the pandemic consideration and assertiveness that it deserves. In this way, the country will be prepared for the next threatening pandemic or epidemic, being able to protect the citizens. While this pandemic, every time that one of us gets vaccinated, we break the chain of transmission. Therefore, it is arguable that this is no longer an individual liberty. Also, compulsory vaccination is crucial when protecting those who cannot be vaccinated, such as infants, and those whose vaccinations are medically inadvisable. Even when the pandemic has been around the country for more than a year, the federal government can stop the escalated number of cases and flatten the curve in the process of achieving herd vaccination. Creating a precedent will prove that the Supreme Court is up to date and able to adapt to the challenges that the future will bring. Thank you.
Question for Maria.
Do you think that the federal government could attach like a tax or a penalty to states that don't that don't follow their mandatory vaccination guidelines, and would that help kind of garner more legitimacy?
You're giving a hypothetical.
Yeah, like for a federal plan.
I don't think so. I think that it would be either the state is handling it or the federal government is. I don't think that it could be like an in-between, if that makes sense.
So you're saying that you think the federal government should be in charge of contributing or distributing the vaccine?
Yeah, making it like compulsory that people have to get it.
So,
She's arguing more than making it available. They're arguing to make everyone take it. That's it.
so how do you, propose that, like, they enforce the states to handle it when it's since it's going to be such a strong federal mandate?
I didn't hear the last part. How do you?
So, since you want it to be a federal mandate,
Mm-hmm.
how do you propose that they encourage or make sure that the states distribute it properly?
I mean, it for sure would be complicated, but as I researched like about other things and news and hypotheticals, I think that the best way would probably be like starting by making it like mandatory for going to school or mandatory for jobs, and in that way they could probably keep the track. If that, yeah.
So it's your question about how do you manage
To
a
work
mandatory vaccine of 300 million people?
To work with the states since it's a federal mandate.
Other questions? So Maria, what is your strongest argument? The Commerce Clause?
Yeah, I would say that the Commerce Clause. And probably also the fact that none of the states have done like the best job with the pandemic. So that probably supports the fact that the federal should like be leading this. But yeah, like legally, the Commerce Clause.
Thank you. We have a, okay, so do you need to set up any slides or anything? So who's gonna go first?